Urinary tract infection. It is an infection found within the urinary tract, which is mainly caused by a bacteria, usually E. coli from the GI tract or gastrointestinal tract. It can also be caused by a virus or fungus as well. Urinary tract infection can be found anywhere through the urinary system, such as: first is the lower urinary system, which consists of urethra and gallbladder. In urethra, it is called urethritis, and in bladder, it is called cystitis. The second one is the upper urinary system, which consists of ureters and kidneys. In ureters, it is called urethritis, which is usually associated with bladder or kidney infections, and in kidney, it is called
pyelonephritis.
UTIs typically start in the urethra and spread upward to the bladder and can be found in both lower and upper tract. If the infection is not treated promptly and correctly, it can spread to the ureters and kidneys. Just like in pyelonephritis, which is extremely dangerous because the infection can enter the bloodstream and lead to sepsis. UTIs tend to affect women more. Why? It is because the female urethra tends to be shorter than the male urethra, so it makes it easier for bacteria up to the urethra and makes its way to the bladder. Another thing is the close proximity of the rectum and urethra make the bacteria easier to migrate to the urethra, especially when the woman is not wiping properly and wearing tight underwear.
For the causes of urinary tract infection, we must remember the hard to avoid. Hormone changes. Pregnancy, menopause, birth control changes the normal flora in the vagina that normally fights bad bacteria that can migrate into the urethra. Antibiotics changes the normal flora of the body. Renal stones causes blockage. Urine stays in kidney and can't drain. Diabetes compromise circulation. Immune system not able to work as strong as it should to fight the infection. High glucose in urine, breeding ground of the bacteria to flourish. Bladder doesn't empty as it should. Urinary retention from nerve damage. Toiletries, excessive bubble baths, powders, perfumes, especially scented tampons and sanitary napkins. Obstructive prostatic hypertrophy seen in males with BPH. The urethra, which is surrounded by the prostate gland, becomes squeezed shut from the large prostate gland. Urine stays in the bladder because the patient cannot empty it completely, and the prostate gland isn't able to properly secrete the fluid with antimicrobial properties. Vesicoureteral reflux, or VUR, is most common in pediatric patients and is when urine from the bladder backflows into the kidneys. It is usually a congenital defect to the uterovesical valves that are found between the bladder and ureters. They don't close properly and there is a backflow of urine into the ureters. Overextended bladder. Bladder is full of long periods of time and the bladder muscles became weak, which leads to urinary retention. Patients who are immobile are at risk for this. Indwelling catheters, invasive procedures, intercourse, especially with the usage of spermicides, incontinence of the bowel. Decreased immune system can't fight germs or immunosuppressed and majorly at risk for UTIs that are fungal and viral in origin.
Urinary tract infections don't always cause signs and symptoms, but when they do, they may include: first is a strong, persistent urge to urinate. The second one is the burning sensation when urinating. Third is the passing frequent small amounts of urine. The fourth one is urine that appears cloudy. Fifth is urine that appears red, bright pink, or cola-colored, a sign of blood in the urine. Second to the last is a strong smelling urine. And the last one is the pelvic pain in women, especially in the center of the pelvis and around the area of the pubic bone. UTIs may be overlooked or mistaken for other conditions in older adults. Each type of UTI may result in more specific signs and symptoms depending on which part of urinary tract is infected. If you have a acute pyelonephritis, you may experience back pain or side pain, high fever, shaking and chills, nausea and vomiting. If you have cystitis, you may experience pelvic pressure, a lower abdomen discomfort, frequent painful urination, and blood in urine. And if you have urethritis, you may experience burning in the urination and discharge.
Common risk factors. Urinary tract infections are common in women, and many women experience more than one infection during their lifetimes. Risk factors specific to women for UTIs include: Number 1. Female anatomy. A woman has a shorter urethra than a man does, which shortens the distance that bacteria must travel to reach the bladder. Number 2. Sexual activity. Sexual active women tend to have more UTIs than do women who aren't sexually active. Having a new sexual partner also increases your risk. Number 3. Certain types of birth control. Women who use diaphragms for birth control may be at higher risk, as well as women who use spermicidal agents. Number 4. Menopause. After menopause, a decline in circulating estrogen causes changes in the urinary tract that make you more vulnerable to infection. Other risk factors for UTIs include: Number 1. Urinary tract abnormalities. Babies born with urinary tract abnormalities that don't allow urine to leave the body normally or cause urine to back up in the urethra have an increased risk of UTIs. Number 2. Blockages in the urinary tract. Kidney stones or an enlarged prostate can trap urine in the bladder and increase the risk of UTIs. Number 3. A suppressed immune system. Diabetes and other diseases that impair the immune system, the body's defense against germs, can increase the risk of UTIs. Number 4. Catheter use. People who can't urinate on their own and use a tube or catheter to urinate have an increased risk of UTIs. This may include people who are hospitalized, people with neurological problems that make it difficult to control their ability to urinate, and people who are paralyzed. Number 5. A recent urinary procedure. Urinary surgery or an exam of your urinary tract that involves medical instruments can both increase your risk of developing a urinary tract infection.
Diagnosis. Tests and procedures used to diagnose urinary tract infections include: Number 1. Analyzing a urine sample. Your doctor may ask for a urine sample for lab analysis to look for white blood cells, red blood cells, or bacteria. To avoid potential contamination of the sample, you may be instructed to first wipe your genital area with an antiseptic pad and to collect the urine midstream. Number 2. Growing urinary tract bacteria in a lab. Lab analysis of the urine is sometimes followed by a urine culture. This test tells your doctor what bacteria are causing your infection and which medications will be most effective. Number 3. Creating images of your urinary tract. If you are having frequent infections that your doctor thinks may be caused by an abnormality in your urinary tract, you may have an ultrasound, a computerized tomography or CT scan, or magnetic resonance imaging or MRI. Your doctor may also use a contrast dye to highlight structures in your urinary tract. Number 4. Using a scope to see inside your bladder. If you have recurrent UTIs, your doctor may perform a cystoscopy using a long thin tube with a lens or stethoscope. To see inside your urethra and bladder, the cystoscopy is inserted in your urethra and passes through your bladder.
Antibiotics usually are the first-line treatment for urinary tract infections. Which drugs are prescribed and for how long depend on your health condition and the type of bacteria found in your urine. Simple infection. Drugs commonly recommended for simple UTIs include thimerosal or sulfamethoxazole, Bactrim, Ciptra, and others. fosfomycin or monorol, nitrofurantoin or macrodantin or macrobid, cephalexin or Caflex, and ceftriaxone. For the prevention, luckily, UTI is a preventable disease, mainly focusing on the hygienic practices of the individual. Number 1. Avoid bathtubs. Shower rather than bath in a tub because bacteria in the bath water may enter the urethra. For number 2. Perineal hygiene. After each bowel movement, clean the perineum and urethral meatus from front to back to reduce concentrations of pathogens at the urethral opening. Number 3. Increase fluid intake. Drink liberal amounts of fluids daily to flush out bacteria. Number 4. Avoid urinary tract irritants. Beverages such as coffee, tea, colas, alcohol, and others contribute to UTI. Number 5. Voiding habit. Void at least every 2 to 3 hours during the day and completely empty the bladder. Number 6. Medications. Take medications exactly as prescribed.